So these are one of the few frequent questions in graphics as well as in FRCR 1. So they have given this information over here to calculate 56 and 57 questions. So use the following information for the next two questions. The information that they have given is the prescription is to deliver 300 centigrade to the isocenter, which is located at mid-plane depth of 12 centimeters from equally weighted parallel opposed APPA beams 15 MV X-rays. The jaw setting is at 15 into 15 centimeters, blocked down to 9 into 9 equivalent field size with MLCs. They have given output, that is 1 centigrade per mu, that is for Dmax 100 centimeter SAD technique, 10 into 10 centimeters open field. They have given TMR values for depths of 3, 6, 12, 21 and 24. They have given scatter factor, phantom factor for 9 into 9 and 20 into 20 field size. So the first question they have asked is calculate the mu. So just briefly explaining what this actually means. So the jaw setting is 15 into 15 centimeters, but they have opened a field size of 9 into 9 centimeters with the help of MLCs. So what you have to consider here is, the nearest SPSC values they have given for 20 into 20 fields. So you have to take the collimator factor for 20 into 20 fields and phantom factor for 9 into 9 fields. Okay. Now, so what they have taken, a patient whose mid depth is 12 centimeters. At the mid depth, the isocenter, the patient is receiving 300 centigrade. So two equally AP and PA beam. AP is giving 150 centigrade, PA is giving 150 centigrade. Together it is 300 centigrade at the isocenter. So that's the given information. Now they've asked us to calculate mu. So as we know, the mu formula is dose per field divided by output into TMR. Because it's an SAD technique, so we have to use TMR. If it was SSD technique, we would have used PDD. Okay. Now, so TMR into SC into SP. Okay. So TMR we have to use of 9 into 9 field, and that too at a depth of 12 centimeters. So we have to use this value. So dose per field, as we know, each field is giving 150 centigrade divided by output is 1. TMR at tip is 0.824, scatter factor 1.022, and SP is 0.995. Okay, now we have to calculate 150 divided by 0.824 divided by 1.022 divided by 0.995 equals, we get an answer of 179. So the MUs are 179. The answer is E. Now they've asked a second question. I'll just drop this off. So they've asked in the second question, the dose at the depth of 3 centimeter from the anterior surface along the central axis from AP beam is dash. So what we know from the data given is, this is SAD technique. So from this distance is 100 centimeter. This is because SAD technique, and this depth at mid depth is 12 centimeter. So the outside will be 88 centimeters. Okay. Now we know the dose at 12 centimeters, that is 300 centigrade. At a depth of 3 centimeter is what the dose they are asking us to calculate. So this whole distance is 88 plus 3, that is 91 centimeter. Okay. Now for this, as we know, dose at 3, dose at 12 equals TMR at 3, TMR at 12 into distance at 12, distance at 3 centimeter. This is the ISL, that is inverse square law. So we need to calculate D3 equals D12. I'll push it over there. So it will be D12 is what they have given us, that is 300 centigrade. But from each field what we are getting 150. So dose at D12 from AP field will be 150 centigrade. Now TMR at depth 3 is 1, at depth 12 is 0.824, at distance at 12 is 100 centimeters, distance at 3 centimeters is 91 whole square. Now calculating 150 into 100 into 100 equals divided by 0.824 divided by 91 divided by 91 gives us 219.8, which is almost equal to 220, which is among the options D.